Hello everyone, my name is Vilca Quezada and my research topic is on vaccine hesitancy and its causes. My research question being, what caused attitude change towards the willingness to take the polio vaccine versus the COVID-19 vaccine? Let me explain how I got here. During the COVID-19 pandemic, I was one of the lucky people to not catch the virus, but I did have several friends and relatives that had family members pass away because of it. I fear that I or my family would suffer from the same thing, and that brought up the topic in my mind that research on vaccine hesitancy is crucial because it helps to identify the reasons as to why people are hesitant to get vaccinated in the first place, which in turn can inform effective strategies to increase vaccine uptake. With the COVID-19 pandemic, vaccine hesitancy has become a major concern as it can hinder the efforts to get herd immunity and control the spread of the virus. Let's talk about the relevance of vaccines in general. They can help avoid the spreading of diseases. However, one of the downsides is that there is a vast amount of controversy around them. This brings us back to my research question on what caused attitude change towards the willingness to take the polio vaccine versus the COVID-19 vaccine. The methods I have chosen for my research question are comparative analysis and survey analysis. The independent variables of interest were government trust, scientific reverence, and conspiracy theories surrounding the vaccines. The dependent variable was the vaccination rates during the two epidemics. As for my goal, I want to discover ways or possible options in order for society to be more accepting and knowledgeable about vaccines so we decrease hesitancy. Now let's look at the science behind vaccines. Most of us know what a vaccine is, but to be specific, it would be a substance used to stimulate immunity to a particular infectious disease or pathogen. As for what vaccines are made of, they consist of antigens, preservatives, stabilizers, surfactants, residuals, diluteners, and adjuvants. Antigens are any substance that causes the body to make an immune response against that substance. Preservatives are added during the manufacturing process to prevent germ growth, which can lead to infection, serious illness, or even death. Stabilizers are used to protect the integrity of the active ingredients during manufacture, storage, and transport. Surfactants keep all the ingredients in the vaccine blended together. Residual amounts are also possible during manufacturing, but they help to prevent bacterial growth while the vaccine is stored. Diluteners are the liquid mixed in with the freeze-dried vaccine in order to reconstrict it and provide the final vaccine for administration. And an adjuvant is an ingredient used in some vaccines that helps create a stronger immune response in people receiving the vaccine. Now let's look at some of the works. Let's take a look at a work focusing on contributing to the attitude change resulting from conspiracy theories and rumors. The article, COVID-19 Vaccine Hesitancy in Pakistan, the Need for Measures to Neutralize Misleading Narratives, researched the topic using data connection and news monitoring. The authors call attention to the various conspiracy theories that arose in Pakistan. In addition, the authors illustrate the negative effects this had further on the population, as it had already had several problems relating to vaccination in the past as well. They provide evidence for the distrust of vaccines through the mass media and other sources. To be clear, conspiracy theories are beliefs that some covert but influential organization is responsible for subsistence or defense. This study examines how the mass media in Pakistan is very prone to the false spread of conspiracy theories and false information, hence causing more and more doubt in the virus through the theories told there. Some people may argue that this is part of many communities and in many different countries. Some may state that when the polio vaccine came about, there wasn't a lot of social media to spread false information or conspiracy theories. However, the information given in the article does lack hard statistical evidence, which can lead to many holes and gaps in the claims they are making. I do argue that through all of the social media everyone is exposed to nowadays, there's bound to be some groups of conspiracy believers all around the world that contribute to the attitude change on the willingness of vaccination for COVID-19. This is also why I assume there's a substantial difference between willingness to take the COVID-19 vaccine versus the polio vaccine back then, when social media wasn't a prominent part of society. making it so they're not as easily exposed to the same conspiracy groups as today. Other research articles also state different demographics contributing to the attitude changes towards vaccination, such as the article COVID-19 Vaccine Hesitancy Worldwide, Conscious Systematic Review of Vaccine Acceptance Rates by Malik Salam, Method through Data Collection, Statistical Analysis. The author suggests survey studies on COVID-19 vaccine acceptance rates were found from 33 different countries. The author suggests the highest COVID-19 vaccine acceptance rates were found in Ecuador, being 97.0%, Malaysia being 34.3%, Indonesia being 33.3%, and China being 31.3%. But the lowest COVID-19 vaccine acceptance rates were found in Kuwait, being 23.6%, Jordan being 28.4%, Italy being 53.7%, Russia being 54.9%, Poland being 56.3%, US being 56.9%, and France being 58.9%. Only 8 surveys amongst healthcare workers, doctors, and nurses were found, with vaccine acceptance rates ranging from 27% in the Democratic Republic of the Congo to 78.1% in Israel. In the majority of survey studies among the general public stratified per country, the acceptance of COVID-19 vaccination showed a level of over or equal to 70%. Stratified simply means to be divided by factors such as age, social status, education, and etc. Polio vaccine is another vaccine that has faced hesitancy in the past. Polio is a highly infectious disease that can cause paralyzation and even death. Vaccines has been instrumental in reducing polio cases worldwide, but vaccine hesitancy has led to outbreaks in some regions. One study published in the Journal of Health Communications found that religious beliefs played a significant role in vaccine hesitancy in Nigeria, where some religious leaders promoted anti-vaccine views. In 1990, polio coverage was 55%. This dropped to 31.5% in 1995, and between 1996 and 1999, it dropped to between 26% and 19%. In the 2000s, it increased to 26%, continued to rise to 45% in 2005. These results show that the country's target of eradicating polio in Nigeria by the year 2004 through 95% coverage was not met. Oral polio vaccine OPV3 coverage shows a national figure of 73.95% coverage, with the southeast zone at 86.63% as the highest and the northeast zone with 60.2% as the lowest rate. The trend showed a drop from 38.60% in 2003 to 36.70% in 2006, and an additional increase to 73% in 2010. The OPV3 coverage by states show that Enugu State recorded the highest coverage with 99.11%, while Taraba State recorded the lowest with 18.75%. Another work would be with the history of vaccine development. Wolfkin provides research about the development of the polio vaccine through experimentation with infected monkeys from several sources. Confirming the number of monkeys in his study had remained asymptomatic, but they also developed antibodies. The author persuades the readers of how the vaccines do provide benefits. Lock-in claims can not only the early antibody production in the paralyzed monkeys, but also in the development of the antibodies in those without CSN lesions, suggests that antibody development was an early response to infection of tissue outside the CSN, and that such antibodies might actually protect the CSN from virus invasion. CSN stands for Central Nervous System, and antibodies are what help our body fight off diseases. These findings were recorded on the route to developing the vaccine for polio. Some might see this lengthy experimentation and results in them finding the polio vaccine as safer since it went through more experimentation and was not as rushed. The real-world implications or consequences, influence on others' behavior, decision-making processes, or discoveries related to my findings would be people more willing to ask questions related to their health or vaccinations, doing proper research before deciding on something medically, or even encouraging health communications between governments and their people. In conclusion, vaccine hesitancy is a complex issue that requires a multifaceted approach to address. Society as a whole can play a critical role in properly dealing with it and combating against vaccine hesitancy. Here are some strategies that can be implemented. Education. Educating individuals about the importance of vaccines is crucial to combat vaccine hesitancy. Accurate and reliable information about vaccine safety and efficacy can be disseminated through public health campaigns, social media, and community outreach programs. Building trust. Trust is a critical component in vaccine acceptance. Healthcare providers, public health officials, and government agencies can build trust by being transparent, honest, and responsive to concerns. Addressing concerns. Addressing concerns and answering questions is essential in combating vaccine hesitancy. Health professionals should listen to patients' concerns and provide evidence-based information to dispel myths and misinformation. Incentivizing vaccination. Incentives such as free or discounted vaccines, paid off time, or other rewards can encourage individuals to get vaccinated. Community outreach. Community outreach programs can be used to reach underserved and underrepresented populations. These programs can provide information about vaccines and access to vaccination sites. Collaboration. Collaboration between public health officials, healthcare providers, and community organizations can help to combat vaccine hesitancy. By working together, they can develop effective strategies and tailor messaging to specific populations. So, addressing vaccine hesitancy requires a comprehensive approach that includes education, building trust, addressing concerns, incentivizing vaccination, community outreach, and collaboration. By implementing these strategies, society can promote vaccine acceptance and protect public health. Here are my 3 oral defense questions and responses. The method I chose is aligned with the purpose of my research because it helps convey the acceptance rate of vaccines due to various factors. Methods I did consider and rejected were sociological data analysis to see how certain social groups react to vaccines. I've rejected methods such as experimentation and interviews as they are too time-consuming and implicated to organize with the time given. The real-world implications related to my findings would be that people more willing to ask questions related to their health or vaccinations, doing proper research before deciding on something medically, or even encouraging healthy communication between governments and their people. If I had 3 more months to work on this research question/project role, the additional research strategies I would put into practice would be further comparative analysis specifically on seeing vaccination acceptance between people belonging to poorer living areas versus those in more prosperous areas and compare upon that. I would also include more survey data as it could allow more insight into the reasoning or more prominent standpoints of vaccinations depending on where the surveys are conducted in the world. Here's my works cited. Thank you for listening to my presentation.